Welcome back to our channel. Today we have an important topic to discuss, COVID-19. It's crucial that we stay informed and take the necessary precautions to keep ourselves and our loved ones safe. So, let's get started. What is COVID-19? COVID-19, short for coronavirus disease 2019, is caused by a novel coronavirus called SARS-CoV-2. It was first identified in December 2019 in Wuhan, China, and quickly spread worldwide. The virus primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or even breathes near others. Brief history of COVID-19. The disease was first identified in December 2019 in Wuhan, Hubei Province, China. The initial cases were linked to a seafood market in Wuhan, where live animals were also sold. On December 31, 2019, the Chinese authorities reported a cluster of pneumonia cases to the WHO. The cause was unknown at that time, but soon after, Chinese scientists isolated and sequenced the genetic material of the novel coronavirus, identifying it as a new strain of coronavirus. In early January 2020, the Chinese government took measures to contain the outbreak, including the closure of the seafood market and implementing travel restrictions in Wuhan and other affected areas. However, the virus had already spread to other parts of China and eventually began to rapidly spread to other countries around the world. On January 30, 2020, the WHO declared the outbreak a public health emergency of international concern, PHEIC, recognizing the global threat posed by the virus. By that time, cases had been reported in several countries, including the United States, Europe, and Asia. As the virus continued to spread, countries implemented various measures to control its transmission, such as travel restrictions, lockdowns, and social distancing measures. The pandemic had a significant impact on public health systems, economies, and daily life worldwide. Throughout 2020 and early 2021, scientists worked tirelessly to develop and distribute effective vaccines against COVID-19. By the end of 2020, several vaccines had received emergency use authorization or full approval in various countries. Mass vaccination campaigns were launched globally to curb the spread of the virus and reduce the severity of illness. Despite these efforts, new variants of the virus are emerging and posing challenges in controlling the pandemic. Structure of SARS-CoV-2. Here's a brief description of its structure. Genetic material. SARS-CoV-2 belongs to the family of coronaviruses. It has a positive sense, single-stranded RNA genome. This genetic material contains all the instructions needed for the virus to replicate. Spike proteins. The surface of SARS-CoV-2 is covered with spike proteins, also known as S proteins. These proteins give the virus its distinctive appearance, resembling a crown or corona, hence the name coronavirus. Spike proteins play a crucial role in the virus's ability to infect host cells by binding to specific receptors on the surface of human cells. Envelope. Surrounding the genetic material and spike proteins is a lipid envelope. This envelope is derived from the host cell membrane, and it helps protect the viral components. Membrane proteins. Embedded within the lipid envelope are membrane proteins, also known as M proteins. These proteins provide structural support to the virus and play a role in viral assembly and release. Nucleocapsid proteins. Inside the envelope, the viral RNA is associated with nucleocapsid proteins, also known as N proteins. These proteins help protect the viral RNA and play a role in viral replication and packaging. Other proteins. SARS-CoV-2 also produces various non-structural proteins, NSPs, that are involved in replication and other vital functions within infected cells. How COVID-19 transmitted? The most common modes of transmission include close contact. Being in close proximity, within about 3 feet, to an infected person, can put you at risk of inhaling respiratory droplets containing the virus. This can happen when interacting with infected individuals through conversations, physical touch, or sharing personal items. Airborne transmission. In certain circumstances, especially in enclosed crowded spaces with poor ventilation, smaller aerosolized particles containing the virus can remain in the air for longer periods, and people who inhale these aerosolized virus particles become infected by the virus. Surface transmission. Although less common, it is possible to get COVID-19 infection by touching a surface or object that has the virus on it and then touching your face, particularly your mouth, nose, or eyes. Droplet transmission. Respiratory droplets that are released when an infected person coughs, sneezes, or talks can land on the mouths or noses of nearby individuals, leading to infection. Pathogenicity of SARS-CoV-2. Here's a brief overview of the pathogenicity of SARS-CoV-2. Viral entry. The virus enters the body primarily through the respiratory system. The spike proteins on the surface of the virus bind to specific receptors, known as angiotensin-converting enzyme 2, ACE2, receptors, on the surface of cells in the respiratory tract and on many other organs. Tissue tropism. While the virus primarily affects the respiratory system, it can also impact other organs such as the heart, kidneys, liver, and gastrointestinal tract. The presence of ACE2 receptors in these tissues contributes to their susceptibility to SARS-CoV-2 infection. Replication and spread. Once inside host cells, the virus hijacks the cellular machinery to replicate its genetic material and produce new viral particles. The replication process can lead to damage and inflammation in the infected cells. The newly produced viral particles can then infect neighboring cells, contributing to the spread of the virus within the body. Immune response. Upon infection, the immune system mounts a response to eliminate the virus. However, in some cases, the immune response can become dysregulated, leading to an excessive inflammatory response which can cause damage to healthy tissues and organs. What are the symptoms of COVID-19? Symptoms associated with COVID-19 includes respiratory symptoms, cough and shortness of breath, fever, fatigue, body aches, sore throat, headache, loss of taste or smell, runny nose, nasal congestion, or sneezing, and gastrointestinal symptoms such as nausea, vomiting, or diarrhea. It's important to note that COVID-19 symptoms can vary from person to person, and some individuals may not develop any symptoms at all. Additionally, symptoms can range from mild to severe, and severe cases can lead to pneumonia, acute respiratory distress syndrome, ARDS, organ failure, and even death. It is important to note that older adults and individuals with underlying health conditions such as cardiovascular disease, diabetes, obesity, chronic respiratory diseases, and compromised immune systems are at higher risk of developing severe illness from SARS-CoV-2 infection. How to diagnose COVID-19? Common methods used for diagnosing COVID-19 include polymerase chain reaction (PCR) test. This is the most commonly used diagnostic test for COVID-19. It detects the presence of genetic material, RNA, from the SARS-CoV-2 virus in respiratory samples, such as nasal or throat swabs. PCR tests are highly accurate and can identify an active infection. Antigen test. Antigen tests detect specific proteins from the SARS-CoV-2 virus. They are performed using respiratory samples, nasal or throat swabs. Antigen tests provide rapid results within minutes, but they may have a slightly lower sensitivity compared to PCR tests. Antibody test. Antibody tests detect the presence of antibodies produced by the immune system in response to a SARS-CoV-2 infection in blood samples. It takes time for the body to produce detectable antibodies, so these tests are most effective several days to weeks after exposure. What is treatment for COVID-19? The treatment for COVID-19 depends on the severity of the illness. Here are some common treatment approaches for COVID-19. In mild cases, individuals with mild symptoms are often advised to self-isolate at home, rest, and monitor their symptoms. It is important to stay hydrated, maintain good nutrition, and take medications to alleviate symptoms such as fever, cough, and body aches, under the guidance of a healthcare professional. In moderate to severe cases, for individuals with moderate to severe symptoms, hospitalization may be required for oxygen therapy, medications, and supportive care. This is especially true for those experiencing difficulty breathing, low blood oxygen levels, or signs of organ dysfunction. In severe or critical cases, individuals may require admission to an intensive care unit, ICU, for close monitoring and advanced life support. Extracorporeal membrane oxygenation, ECMO, may be used in extremely critical cases to provide advanced cardiac and respiratory support. How to prevent COVID-19? Here are some key steps to help prevent COVID-19, which include vaccination. Get vaccinated against COVID-19 as soon as it becomes available to you. Vaccines have been shown to be effective in reducing the risk of severe illness, hospitalization, and death from COVID-19. Mask wearing. Wear a mask or face covering in public settings, especially when it is difficult to maintain physical distance from others. Masks help prevent the spread of respiratory droplets that may contain the virus. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after being in public places, before eating, and after coughing, sneezing, or blowing your nose. Physical distancing. Maintain a distance of at least 1 meter, 3 feet, from people who are not from your household, especially in crowded places. Avoid large gatherings. Limit close contact with individuals outside your household and avoid large gatherings where physical distancing may be challenging. Ventilation. Ensure good ventilation in indoor spaces by opening windows or using air purifiers to improve air circulation. Respiratory etiquette. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of used tissues properly and wash your hands afterward. Stay home when sick. If you are experiencing any symptoms of COVID-19 or have been in contact with someone who has tested positive, stay at home, self-isolate, and seek medical advice. Follow public health guidelines. Stay updated with the guidelines and recommendations of local health authorities. Follow any additional measures they may implement based on the current situation in your area. Conclusion. If you experience any COVID symptoms or suspect you have been exposed to COVID-19, it is important to follow the guidelines of your local health authorities, get tested if recommended, and seek medical advice for further evaluation and guidance. That wraps up today's video on COVID-19. If you found this information helpful, please give it a thumbs up and share it with your friends and family.